and we'll see the chats and stuff.
All right, we are live. Good evening, everyone. For those of you joining us for your very first time, this is Nurse Charms Live. Yes, we are live right now. It is 8 o'clock. I'm starting the show on time for a change. But yeah. Invite all of your friends to watch. So please share this video on your timelines. I'm joined here with Nurse Tasha, who I'll just be introducing in just a moment. It's Nurses Week, everybody. So those of you who are nurses, happy Nurses Week. And if you know any nurses, please tell them happy Nurses Week, because this is a time where we celebrate nurses for all the hard work that they do, you know, all of their career long, especially now since, we're in a pandemic and some of us are, working on the front lines right there. So yeah, it's a lot of heroic work that they're doing. So just if you know any nurses, tell them happy Nurses Week. I just want to go over a couple things here. We're not being endorsed, so all of our thoughts and all of this information that you hear is based on scientific evidence and facts and our experience. So no one is paying us to say the things that we're saying. We're just saying this, as experts in our own right. And also, I want to make the disclaimer that everything we say is for educational purposes only. So I don't want any liability. Nurse Charles told me this or that. Always go follow up with your private physician, your primary care physician, because they'll know more specific about your full health background. But you can ask whatever questions you like. Let me make sure this comment feed is open here. Yep. Comment feed is open. So, this is a Q&A format. So you can ask as many questions as you like. We'll answer them. If we run out of time, we'll circle back and come on the comment feed and, answer them personally. Tonight, we're going to be talking about politics and policies. I know y'all probably like, they're nurses, but listen, we got skin in the game. We are licensed professionals. So that means we have some say so in the laws. We're regulated by the state. Each nurse is licensed in her own state, in their own state. So, we have some skin in the game, and, we've been following this whole COVID pandemic, and, we have some thoughts that we want to talk about, and we want all of you to talk about it as well. So again, I ask that you share this video, and we're just going to go ahead and get started. Nurse Tasha, happy Nurses Week to you, beautiful. Thanks for joining me. How are you?
Thank you, Miss Nurse Charm. Thank you so much. It's such an honor to be here. Happy Nurses
Yes.
Week to all of my fellow nurses. The struggle is real.
Yes. So go ahead and introduce yourself
Okay.
to everyone who's watching us.
Okay, my name is Tasha Young. I am a registered nurse, practice performance consultant. I work for a large insurance company in the Medicare division, training and consulting on clinical quality and Medicare star rating improvement with primary care physicians. I've been a nurse since 2003, so I'm repping the class of 2003, and even more, I'm repping diploma grads for
All right.
2003.
All right. And what's your home state? What's your home state?
Oh Lord, I done been around. I got all of my training from Richmond, Virginia. I went to University of Virginia, got my BSN. I started out as a diploma grad, Bon
Okay.
Secours Memorial School of Nursing in Virginia, and I moved here. I'm here in Atlanta now.
Oh, nice. Oh my gosh. I would love to be in Atlanta. You guys are one of the
Yes,
first people to open up, huh?
yes, ma'am.
Yeah. So I'm gonna get to that in a few.
Okay.
But first, tell us a little bit about your experience. Your background, like from fresh out of nursing school. Let us know your experience and bring us all the way up to what you're doing now, if you're working with COVID patients or what's going on.
Absolutely. I started my nursing journey in 2001 in a diploma program. I graduated in 2003 as an ICU new graduate nurse. I did that for about a year. I had an opportunity to transitioned to another health system where I worked in cardiac telemetry, CCU, still worked in critical care, but less acute. Did that for about 3 years. I have a
Mhm.
very rich nursing experience, so I love talking about it. So I went from clinical
What
nursing to
nurse doesn't like talking
I
about it?
know because my senior year of nursing of the nursing program, I made a promise to myself. I said every year for the first 5 years, do something different. And I did that. So I did the clinical nursing. I taught LPN school. That got me into insurance and managed care industry. That's when I was working mainly for Blue Cross Anthem brand in Virginia. Did case management, disease management, nursing. We were in a call center environment. I learned how to be a consultant. That fueled my passion for consulting. I end up becoming a project manager in nursing. I end up consulting in nursing, working in quality. I've kind of done it all, and I'm also military nurse. And so, early in my nursing career, the first year I was recruited into the United States Army Nurse Corps.
That's amazing. Look at you. You
Yes,
go ahead,
ma'am.
girl. So you're not directly working with the COVID population, right?
Not providing direct patient care to the COVID population, no.
Right. And yeah, that's still fine, you know what I'm saying? You're still doing your thing because the thing about nursing is like literally we everywhere, you know what I'm saying? In every aspect of the hospital,
Mm-hmm.
you can apply a nurse in that situation. So
Mm-hmm.
that's one of the beautiful things,
Yeah.
it's all the flexibility. Yeah, so let's just get right into this
Okay.
COVID-19 discussion. So
Okay.
first I want to talk about how there was the health department in Pasadena, California. They made a release stating that there was a family event, there was a birthday party, and someone at the birthday party was coughing,
Mm-hmm.
and that person ultimately infected some other family members. And so they're saying that this happened. It actually happened in March
Okay.
after the stay at home orders.
Okay.
Because in California they were one of the first people to institute the stay at home or safer at home orders or whatever. So basically just seeing all of that, they're using that situation to say that talk about the community spread,
Mm-hmm.
and so right now a lot of states are still on either partial lockdown. Well, actually, most of them, I think it's like we're up to like 45 states, and most of them are either partial lockdown or either their
Phase
lockdown
one. Mm-hmm.
is
Mm-hmm.
lifted. What did you say?
Or try to start some phase one kind of
Right.
activity.
Have
Mm-hmm.
started going through the phases. In Michigan, we're in phase 3. Um,
Mm-hmm.
So anyway, there's a lot of people who are ignoring,
Mm-hmm.
this stay at home order. So what is your opinion on that? Is that reckless to just go ahead and do your thing? Should people be following these orders? People still aren't wearing masks. Some people don't want to wear masks. Some people just
Mm-hmm.
they don't believe that it will help.
Mm-hmm.
There was this recent documentary. I hate to say any reference to it because I personally don't believe that documentary was 100% authentic. I mean, some
Mm-hmm.
parts, but a lot of parts, I don't know. I feel like it was like more drama or whatever.
Mm-hmm.
But anyway, there's some people who feel like, masks, they're just gonna recontaminate you, so there's
Mm-hmm.
no point in wearing them. Or some people just don't like the feel, around their
Mm-hmm.
face, so they just don't want to wear, or they just feel like this whole, thing with the government telling you what to do,
Mm-hmm.
as a free citizen, they don't like that either. So anyway, tell us how you feel about, these stay at home orders.
Okay. Oh my gosh, this is such a good
Being that you're
question.
not on the other side, and you guys just kind of
We're kind of
leapfrog through the you
mhm.
guys leapfrog through the orders.
Well. This is my opinion. This is my personal opinion. I'm gonna give you my professional opinion. My personal opinion is that if you look at the CDC guidelines and you see how you're protecting yourself from the spread, it's really things that we should be doing on a regular basis. The only component that they added in was when you go out into the public and you know you might be affected or have symptoms, you should cover up, wear some type of cloth cover or some type of mask. But if you look at the other precautions, washing your hands, trying to avoid close contact, most of the guidelines are really aimed at people who are holding the symptoms, who think they are or could possibly be infected with COVID. And so I think it's something that you should take serious. Definitely, if you have underlying health issues, if you have underlying respiratory issues, this situation is nothing to joke about. So you definitely should, especially if you got COPD, you're a smoker, bronchitis, asthma, and all of that stuff that's in our community, right?
Right.
You should take these guidelines serious. But if you look at the guidelines, we should have, COVID is, to me, is just exposing. We should have been washing our hands, paying really attention to the sanitation and how we kind of contain our areas and how we distance ourselves from people who got infectious diseases that spread respiratory rise.
Right, right, right. So that's your professional opinion or your personal?
That's my personal opinion. Like we should be very mindful of how we navigate, especially moving forward, in terms of how we wash our hands, because we're nurses. So when we wash our hands in the bathroom, when we go to public places, we're looking at people. You're like, you ain't do 15 seconds under that sink. You people go 1, 2, 3, to, but that's not been healthy, really. And so COVID is really highlighting a lot of the practices that we have not really been very mindful about. Now, my professional opinion is CDC has guidelines, and as a person who's immunocompromised, this is not to be taken lightly. So it's probably not wise for you, if you immunocompromised with respiratory issues, to be in a place where you're coughing, you're not covering your mouth, and you are around other people, because you could have the symptoms and not even know it.
Right, that's so true. Now, I did see on social media a picture. I want you to get into a little bit about what's going on in your world, because
Okay.
you're in Georgia, you're in Atlanta. I
Mhm.
did see a picture. Like, has it been 2 weeks yet since you guys have went
Probably in about 2 weeks.
a
Was it?
week
Yeah.
or two or something? Yeah, so I saw a picture that people were lined up at Lenox Mall. I don't know if you saw it. But yeah, they were standing outside Lenox Mall at the Louis Vuitton store. You know what I'm saying? I mean, it's like during a pandemic, and these people are at this high end fashion store, about to get their shopping on or whatever. And I mean, from the picture, it's hard to really tell. It looked like they might have been 6 feet. Look, to be honest, it looked like maybe 4. But I mean, whatever, they were spaced out. You know what I'm saying? But I don't know. So do you feel that it was appropriate for your governor to open up the state, or do you feel like he should have waited? And then we have heard that you guys have experienced a spike, but I really take that spike with a grain of salt, because I mean, if you're in the house, you know what I'm saying, during the stay-at-home order, and now everybody says come out, then of course, just by numbers alone, is the cases are going to go up. You know what I'm saying? If people are congregating, then yes, it's going to go up, especially if people aren't using precautions, if people are out with no mask and all of that stuff. The virus, what people have to come to a reality is this virus is going to continue to spread until it weakens, or until we get a vaccine that works and that everyone agrees to take, right? You know what I'm saying? People just, I don't know. Well, when it first started, nobody really knows. People still are learning
Mhm.
every day. So to their credit, but President Trump was misinformed, because he made the picture that it was going to go away in the summertime. And that's not all that true. Although they did do some research that says that, the virus dies, in ultraviolet light,
Mhm.
or, heat, humidity. So that part has been researched and proven true. But
Mhm.
at the same thing, in general, is not that, oh, the hot weather's going to get here and the virus is going to be gone for the rest of our lives. That is not true, because we see that other places in the world are hot and they're still experiencing, rises in
Mhm.
cases. You know what I'm saying? Florida, Australia. So
Mhm.
that part wasn't true. But what are your thoughts on that?
Okay, so what I look at is I try to stay kind of abreast of the provisional death rates the CDC is now posting, and they even posted by state. And so I feel like I think that it's very correct for the president to have, a slow, gradual reopening in phases and to focus on safety. And I'm okay with it because when I look at Georgia's numbers, we've only had 739 deaths to date. This is as of May
Since
11th.
since this beginning, you guys have only
700?
had, you guys haven't even went over 1,000.
Nope, not according to CDC's. And this is up May 11th, updated May 11th. They have provisional death counts. So that
Wow.
so seven, but we have a population of 10 million. So there's this health and safety risk component, but even when you're talking about reopening and opening an economy back up, there are some serious health risk and death risk when you don't do that, right? So as a health professional, we know that we have a lot of mentally ill people. We have a lot of people who don't do well in isolation mentally, and we have a lot of
Right.
people who have substance abuse and substance use disorders, and on top of being unemployed, right, on top of being furloughed.
Right.
So,
Right.
there's this delicate balance that we have to look at. So I'm okay with phases and opening, and I feel like as long as we have something where we can count, and we maybe CDC can bump up maybe by zip code and area, and do some modeling, how they have those real-time models, if they can do that by zip
Right.
code, so that people can make the decision based off of the information that they have. But yeah, we only have 739 deaths out of 10 million people in the state. So I say, I'm wondering who's thinking of Louis Vuitton, right? I'm trying to
Girl,
figure
I
out
do not. Right. That's what
who's
I'm saying. I'm like,
who's thinking about Louis Vuitton like right now.
girl, I have no clue. I mean, I don't know,
Like,
but but you do bring up a good point, and I mean, this is a point that a lot of people have been saying. They've always been like, well, what about the flu, or what about everything else
mhm,
going on? I
mhm,
know President Trump, he brought up in his press briefing today, he said, keeping people home isn't a solution either. And I know I put up a study about that, and
mhm,
that caused like a whole uproar. People was like, you can't be posting this and all this stuff. But I mean, it is true. You can stay in the house. That doesn't mean that nothing will happen to you perfectly.
absolutely.
It's a virus, and it's so many. I mean, we really don't know the extent, you
Mhm,
know, of how you really get it. We think the surfaces, and 3 up to 3 days, you know what I'm saying, the
mhm,
coughing, the droplets and stuff. I mean, but we don't have a definitive of like, okay, A, B, and C,
right.
or X, Y, and Z. It's still been studied and researched. So I mean, yes, staying at home can decrease it, but it can't totally eliminate it. And then, like you said, I mean, there's depression. There's
Oh,
suicide, and
suicide. Yeah,
there's drug people taking drugs and stuff. So there's still reasons that can cause people to die outside of COVID. So, like you said,
absolutely.
yeah, but we're getting some people on the comments, so I'm just gonna pop over here and see what
Okay.
they're talking about. And if you guys are asking questions, unfortunately, Facebook does like a 10-second delay between this software I'm using and
Uh-huh.
their platform. So if it seems like, you know, that's the reason why. Hello, Miss Rogers. Thank you. I appreciate that encouragement. She just says, keep up the good work. Let's see. Thomas, can you see it on the screen?
I can
If so,
see
can you go ahead
Barbara.
and read
Oh,
it and
I've been
answer it?
seeing barbers cutting hair on Facebook Live. They were saying that they were practicing quarantining, but they were cutting hair with no PPE. Just Okay, so let me give you uh, okay, my daughter came yesterday. She's 25, celebrating Mother's Day, and she was actually speaking to one of my neighbors who's a single parent, who's a beautician, who has been impacted by this greatly with the stay-at-home order. She has a kindergarten daughter, and I didn't know that the school system, a lot of the teachers are not teaching here. They're giving the work to the parents to teach. So we have to be very careful, like when we're assessing these situations. It's easy. We got to take a look at, and I didn't realize when my daughter told me, she said, your neighbor, she's a single parent. She was unemployed for a while with COVID. The state opened back up and she can only see one patient at a time. And remember, beauticians can multitask. They can put a perm here, do this, and so now she can only, that's cut her salary.
Oh, so that's how they doing it down there in
We have to
Atlanta.
practice, we have to practice the social distancing. So if you're the person used to say you can braid this person hair up real quick, you can do that. You can do 3 heads in the span of an hour. She
Right,
can't do
right.
that. So she can't see but one person at a time. She has a daughter she has to teach kindergarten work to, and she has rent
Oh,
to pay. So
right, right,
when we're looking at these orders, we have to understand that there are people in our society who are not as prosperous as us, and even hopefully we'll talk about this nurse is laid off right now. But you have
right,
people who are not healthcare professionals, where the money can stream in, we can work from home and do different things. So barbers and stylists and massage therapists, this is their bread and butter. This pays rent, utilities, everything. This is a
but like
very
Thomas said, if they're gonna do it, at least wear the PPE. Like for instance, we have a story broke today where
Mhm,
this in Michigan, this barber, he actually went to court, and the attorney general, the judge ruled against the attorney general.
mhm,
And this is all publicized. The judge ruled against the attorney general and let the barber go free. Is an older man, and he went free. He's like, I gotta pay my bills. I want to work. I don't want to be on unemployment. So like he's in
mhm,
defiance of the governor's order. So I mean, and then there was another stylist. Was that in Georgia? It was a
mhm,
Caucasian lady. I can't remember, but I
mhm.
know in different states or whatever, there's been specifically barbers and beauticians that are still working and like screw the governor's order. I mean, I get how they trying to save their business and they need money, but at the same time, at least just be smart. I mean, at the end of the day, I really don't know. People are gonna do what they want to do. You know what I'm saying? They're not phased by the thought of jail time or whatever.
What, what
Go ahead and read this one.
what is the point of staying in quarantine when people are asymptomatic and kill and can still spread it? We can't stay in forever, and it takes years to develop a vaccine. Very good point. That's a
Yep,
very good
I
point.
agree.
And the thing about mask is, see, I think right now we're in a very delicate space with this COVID situation, because where some states are teetering on the line of disrupting uh, questionably constitutional rights. Now, the
Right,
Constitution provides rights even in bad times and good times, and there are emergency situations where certain rights are taken away. But CDC has guidelines; they're not rule of law, and the president, the White House has guidelines and not rule of law. And so they're saying
right.
these are guidelines, guys.
Right.
So
The White House never once said that if you don't follow this, you're going to jail. That
right.
has been what the governors like.
Mhm.
The governors have said these things, and then they've enforced it by making it a law. Like in Michigan, it's a law. Like you'll get $1,000 fine, and you risk your business license being snatched.
And that's
So
that's pretty severe. That's a bit severe, given because we have to look at what's Michigan's population, what's going on with Michigan. Does it truly warrant that? You understand? And so we have to be careful, because there's a new bill that's being introduced. Have you heard of the HR 666, the Trace Act?
what's that?
Okay, the Trace Act is this new bill introduced by Rep. Bobby Rush from Illinois,
Uh huh.
basically authorizing the Secretary of Health and Human Services to award grants to eligible entities to conduct diagnostic testing for COVID and related activities, such as tracing it in mobile apps.
Oh yeah.
Yep.
I heard about that.
So that
Yeah.
so when we start, I feel like we got to be careful not to acquiesce to a lot of this stuff, because it can open up Pandora's box to a place where now people are talking about tracking people who are positive. having apps saying where's your location, this person's been tested positive, is he home,
Right.
does he have a
Right.
mask. Now they're talking about doing it in Uber and Lyft, and that's, I feel like that's a little bit too much, and once we implement that, you can't take that back.
Right. That's true. But yeah, to your point, Veronique, I've been saying this all along. You know, it's a virus is going to continue to spread until it weakens or until we get a vaccine, which vaccines, they're trying to fast track vaccines. Vaccines take every bit of 3 years, okay? And
Hmm.
they can even take longer because they have to do clinical trials. They have to prove that they're effective. You know what I'm saying? So I mean, they're trying to fast track it, and I don't know, but in the meantime, just staying at home, I feel like that just prolongs it,
Hmm.
and then I mean, and then like you said, it's that balance. It's like, okay, do we just do a one size fit all approach and keep everybody at home? You know what I'm saying? When is we really should be keeping and testing the vulnerable population.
Right,
So
that's a good
yeah,
point. That's a
it's
good point.
big ethical thing. Let's see who we have over here. Anthony says hello.
Anthony.
Hi from Anthony. Let's see, we got some more comments. Okay, where are we at right here? Thomas, go ahead, read that.
And they say they were sterilizing equipment at 75 degrees. I thought you had to keep temperatures at 140 degrees. Okay.
Oh, okay, that's he's talking about with the beauticians and barbers and stuff, their
Oh,
your utensils.
okay.
Yeah, yep. Um,
I think we should just test this group of people, these business people who provide services, and they have to be in close contact with people. Um, I think we should kind of monitor and just do the surveillance like we've been doing. And if we see an increase in people who are barbers and beauticians, then make a decision, but maybe not be so quick to, if they're, I feel like they have to follow the guidelines as best as they
right,
can. Follow them as best as you can, but we have to also understand, guys, that these people got to eat. So, if they're willing to do a risk benefit analysis and say the risk of me and my clients getting it is not as bad as me not wearing my mask, they are within their legal rights, and we have to respect that. Now, if we start seeing people dropping like flies, people getting sick coming out the barbershop, then we can start saying, we told you.
yeah. Here, go ahead. We got another comment.
If you have a rotten potato in the bag, if you don't take it out, they all will rotten in 2 weeks. So that must be a metaphor for, if one person is not following social distancing, then everybody won't, I'm assuming. Good evening,
Yeah.
Angie. Thank you. Happy birthday. Happy birthday.
Thank you for watching. We appreciate your support. You want to read this one?
This look like the same statement. Oh, okay. If you've got rotten potato in your bag of potatoes, if you don't take it out, the rest of them will be rotten in 2 weeks. Is the same as the virus. Okay, so again, I'm just looking at, because if you look at, like, I'm looking at the death rates in front of me on CDC screen. So Arkansas, let's see, I'm looking at the state that had the least amount of deaths. Montana, 15 deaths. So do we want Montana to be shut down, their economy,
Yeah,
people
exactly.
unemployed for 15 deaths? And this is since the COVID was a pandemic, since COVID
You
came.
you know what? I'm glad you brought up Montana. They opened up their schools. Their kids are
Oh,
going
good,
back to school.
good. Well,
Yeah,
good,
yeah.
good.
Their kids are going back to school, and actually the parents, they did a vote, and the parents said they wanted their kids to go back to school,
Awesome.
and they're
Awesome.
implementing the social distancing and everything for the kids. But I think in that particular school, they only had like 70 kids or something like that. But yeah, they went on ahead and opened. Let's see, we got a
And
comment from Angela. You want to read
governors
this?
are overstepping their boundaries with these draconian laws. It's sickening. Yeah, I think we got to look at each state, and I'm looking at each state's really, they're out of all of our 50 states, nobody is over 3,200. Well, okay, the New York, in New York City, California, but if you look at how big these states, California got almost 40 million people. But even with California, they've only had 1,600 deaths. Like, I don't think we
Yeah.
should be draconian with 40 million people in your state, only 1,649 deaths up to May 11th. Yeah, we have to be careful, and we have to really hold these states accountable to making sure that they are doing this because they are concerned about the health and welfare of the constituents. Or do they have
Right.
any other motivating factors? And we have to be very mindful of that.
Right, right, right,
Right.
right. Thanks, Latrice, for supporting us tonight. We appreciate fast tracking vaccines are very concerning. Yeah, they are concerning, but President Trump, he did say that he would be the first one. I was watching a press conference. He said he would be the first one to
He say that.
take the vaccine. Huh?
He would be the first
What'd you
one to
say?
take it.
Yeah, he said he would be the first one to take it whenever it gets ready. He said he would be the first one to take it. I will not be the first one. I will take it.
Well,
You
you
know what
know
I'm
what?
saying?
I appreciate a leader who's willing to put his life on the line and take it first before he have other people do it. Because you got
Thank
some people saying, "Oh, y'all can try this," but they would never try it.
right, right, right. So yes, thank you. Thank you.
Thank
We
you,
appreciate
Angie.
all of your comments going here, you guys. So people are restless. So
Mhm,
and people are coming to a place of, I guess I would just say reality. They're like, look, I'm willing to take the risk.
mhm,
I want to get back to work.
mhm,
I don't like this socialist form of living off the government,
mhm,
unemployment and all of that. And so, people are willing to uh take the risk. If I'm whatever's going to happen is going to happen to me. So do you feel like that's selfish, or do you feel like they're just being realistic about the situation? The virus isn't gonna just magically go away. It's gonna be around.
mhm,
Scientists and epidemiologists, they're predicting it's gonna be around for a couple years at least. So,
mhm,
I mean, and this is one of the things I've been asking myself, like, at what point do you accept the risk? And I understand, I'm not trying to devalue anyone who's immunocompromised, but it's a fair question though. At what
mhm,
point do you take the risk? Like, I'm not immunocompromised. I want to go back to work, not because I'm selfish, but I really have bills to pay. You know what I'm saying? And I really just love what I do. I just want to get back to work. And I feel like we can do this through the phases and keep the people who are immunocompromised, keep them home. It's the same thing as if people, the cancer patients, the people who have cancer, they know that, it's in the best interest of their health to, not be out here because, your white blood cells that fight infection and all those counts are low. So they know what
mhm.
they have to do. So it's kind of the same approach until, you could get a vaccine or something. So I don't know. So do you feel like people who want to go back to work are being selfish and not considering that, the virus is very contagious and that even while asymptomatic, we could be spreading it to people? Do you feel like those people are selfish, or do you feel like, I mean, it's like a catch 22, and you have to be realistic about, the economy and just about the sanity of people. You know what I'm saying? I'm losing my mind being in the house every day.
Right,
Like, I
right.
don't like
I don't. I,
it.
I don't either. And I normally telecommute, so I don't think it's selfish at all because I understand as a nurse. Now we're supposed to be looking at things holistically, so we're supposed to look at the entire person. And a lot of people get energy from being around other people, from doing things they enjoy. And I did some research on isolation, and it's very unsafe for our brain to be isolated for as long as we have been isolated, because as you can see now, you have people who are going to be afraid to be normal again, and that's
Wow.
very
You
unsafe.
saw some research studies on this?
Well, there's research in the mind and isolation. If you research what isolation does to the mind and the health of the mind, it's not healthy.
Right, right.
I researched that it disrupts sleep patterns, and it's done that for me because before COVID, I was up 5:30. I had a routine workout, have my morning ritual, and I don't have that. My sleep pattern is off. Um,
Uh-huh.
there's a lot of different things that have changed with me because of isolation. I even think my menstrual cycle has changed. My
Mm-hmm.
menstrual cycle timing has changed. So isolation really throws off some things in our body.
Yeah.
And as you can see, it's creating a place where people are anticipating more isolation than living.
Right. Right. Yeah. Let's see. We got another comment over here.
I
Thomas, you
think
want to go ahead and read that?
Sure. I think checking temperatures at the door when entering buildings give a person a false sense of security because the person can still have the virus and doesn't show symptoms. But the 99% of the people who have the virus have fever. So that's the reason for checking the temperature. Like we have all kinds of ideas that we're doing right now, which is good that we're coming up with different ideas, but at the end of the day, I think what we have to do is just kind of continue to look at the populations who are affected and continue to understand that at this time period, you have more people dying from other things than COVID. You have at this time of the year, as in other years, you have over 107,000 people dying of other stuff that they've been dying from on a year-to-year basis: heart disease, diabetes, asthma,
Right.
and all these other things. And so I feel like when COVID was first brought into our awareness, I believe the way it was brought into our awareness has created a lot of uh, hysteria. We're beyond concern of risk. We're at the place of we're still kind of hysterical about this, and so it creates a it's difficult to kind of reason and look at a future because we still think it's much more deadly than the flu, which is not. And it spreads, they're saying, faster, but it's not proven to be more deadly. So we have to put it all into perspective when we're talking about different policies and different procedures, how we're going to open up. We need to keep that in perspective as we move forward to make sure that we're reasonable.
I mean, and that's a good point you brought up, the hysteria, because we got people so frantic and hysterical about this COVID, and these same people who are hysteric, have all this hysteria. Guess what? They are not eating a healthy diet. You know what I'm saying? They are not. They are not taking their high blood pressure medicine, or
Hello.
their insulin. They're not monitoring any of that stuff. They're not exercising. They're not drinking enough water. They're smoking or doing other drugs. Unprotected sex. They're doing all these other things. But here you are concerned about a virus, a virus. You know what I'm saying? You concerned about this virus that the data has shown that over 90% are going to recover. Like here
Recover. Exactly.
here in Michigan, I think we're up to like 43 cases now. And half of our people have recovered, which is a good thing.
Awesome.
And I pray
Awesome.
the other half recovers. But it's like you got people scared to death. I don't want to come out. I don't want to do this. Keep us at home and all of this stuff. And I'm like, you got to get out of this
We got to
fear.
get out of that fear.
People are recovering. You need to, I mean, it's so many other things people got to focus on besides, COVID. You know what I'm saying? Like this is your health. You know what I'm saying? Like you need to be keeping your immune system healthy on a regular basis, not just, now because of COVID. So yeah, I do
You
feel
nailed
like some media, I'm not trying to knock media outlets in general, but some have, just, really painted a picture of like doom and gloom and fear, you know.
and it's programming. So that's the important. So that's how deep programming is. When you have to be careful when you watch certain things, make sure, and I'm telling you professionally and personally, you should always vet information out. You should vet the information
Right.
out, and you should make sure, do all of your due diligence and do all your fact checking that you have to do with it, and you make a decision that's best for you and your family. If you live in Montana with 15 deaths, or even Delaware. Well, let me see. DC, 121 deaths. District of
Right.
Columbia had 121 deaths, updated May 11th, today, as of today. 121 deaths. You still, you if you live in the state of, if you live in the District of Columbia and you are blasting all of this hysteria, your hysteria by the numbers is unfounded. DC has a large
Right.
population. I'm sure millions of people live in DC.
Right.
121 people. you
Right.
know,
You want to read this
sure.
comment?
I think the cure is to give everyone a small dose of the virus to get their body used to it.
Lord, we could never do that. That would be a conspiracy for real.
Yeah, we
But
ain't
I
got
mean,
time for that.
I get, I get your sentiment. Okay, so to get into the whole economic component about
Okay.
this, because I've been saying like this virus is the two most important things about this, and how do we balance it? Our health. We want to keep people healthy, keep people alive, and then we also want to keep the economy healthy and keep the economy alive. We don't want to go into a deep depression, although it basically feels like it already is, because people are strapped for cash. You know what I'm saying? People are losing their businesses, losing their homes,
Mm,
can't put food on the table or whatever. And this unemployment, it has been a nightmare for a lot of people. So do you blame anybody for this whole unemployment fiasco? Like, there's some people who, I mean, what are we up into the 9th week of this now or
mm,
something like that? But I mean, it's people who still haven't been able to get a dime of unemployment, and they qualify, of course. I mean, like, how come none of this was managed? How come all of this is just getting exposed? And from what I hear, like, I've heard the director of unemployment in my state talk about it, and I want to paraphrase him because I don't want to mess up any of his words, but it was something to the effect of, the unemployment system is set up to basically, deny people, and to check for, monitor for fraud, because of course, there are some people who aren't honest and try to get unemployment. And he said it's also set up, to be a one-on-one experience. So with
mm.
just like this flood of millions, I think in Michigan, I think we are up to, I'm going to say over 1 million people filed for
Wow.
unemployment. So just that volume. And then he also said it was a staffing issue. They didn't have enough staff, to
Mhm.
monitor the phones and, do all this input and do all of that stuff. So, I mean, is that something that they can fairly take the blame for? I mean, once they saw, back in December, when COVID was announced, from Wuhan to the WHO, to the World Health Organization. Like, look, we got this going on, and then I think in February we had our first cases here. Should they have been, kind of planning back then for this? I'm just trying to see, like, was
Mhm.
somebody to blame, or is just one of those things you really can't
Mm-mm.
manage? I
There's
mean, it's a
somebody to blame,
pandemic.
because
Who?
what I'm learning with COVID, COVID is showing me how states operate inefficiently, and then you have to wonder. You get federal dollars for certain things, you get funding, you get grants. So I think a lot of constituents for different states need to start questioning states. What have you been doing all these years? Unemployment claims processing is flawed. So how long has it been flawed? How many people have been suffering like this before COVID? And
Right,
you've not done anything. And what have you done with my tax-paying dollars?
right.
You're a taxpayer for the state you live in, and your
Hmm.
job paid into your unemployment. So your job did their part. You did their part. Now it's a volume issue. It's volume, and it's process issues.
Right,
That is unacceptable, because here in Georgia,
right.
like my son, he's 21, worked at Party City, went online, boom, bang, bang, got a debit card, no problems.
Oh, no issues with unemployment in
Their
Georgia?
process is a little bit more automated and is electronic.
Okay.
So he didn't have to call anybody. He went online and filed. They keep sending him stuff in the mail every week. He got a debit card. No issues.
Nice. See, yeah, that's not the case in Michigan. I mean, because I keep hearing, like, literally every day, almost
It's other
hour,
states.
on
It's
the
other states.
timelines.
It's other states.
Is other.
And you have to wonder,
Yeah,
so
yeah.
what are y'all doing with our tax dollars?
Right. That exposes that. Yep.
Hmm.
I agree. So what do you feel? Do you agree with the president's response to this? Because, he's been taking a lot of heat. People said that, he didn't do anything. A lot of his statements, it was
Hmm.
almost as if he, debunked the seriousness of it, by calling it a hoax. And a lot of people, and then, recently Obama, was it just yesterday or the day before, he did a radio interview,
Hmm.
and he said, what did he say? It was, I don't want to misquote him either. I want to say something. Did you hear something about catastrophic? I don't know. Basically, it was negative what he had to say in terms of how President Trump handled this whole pandemic. So, what is your view? How do you feel?
Well, I'm just going to put a disclaimer out there. I am a Trump supporter, but
Okay.
I try to give objective information about why I support him. It's not personal, not personality. I have been watching Trump as a leader over the past 4 years, and he has made taken unprecedented steps in how he responded to this virus. And what do I compare it to? Well, I was here in Atlanta during the financial crisis. In 2008, I moved here from Virginia. We had another pandemic going on in that time period. We had H1N1. So I have a comparison point. So
Okay.
when I compare the fact that in the last crisis that we're in, the last pandemic, the people were not bailed out. It was never focused on people were getting evicted, people were losing their houses, foreclosures, no electric company was giving people like they're doing now with COVID,
Uh huh.
all of the efforts to help people stay in their homes, that was not happening when Obama was in office during a pandemic and during our last crisis. President Trump is focused on bailing people out. You never heard him say, we got to bail the banks out. We got to bail the SBA out. We got to bail. No, he says 80% of this country, these businesses or employ Americans. So of course he's got to focus on payroll tax reductions, unprecedented. So he has, to me, from a policy standpoint, done more to show that he cares about small businesses, Main Street, and families through his policies than any president that I've been through in my adult voting life.
Okay, we lost some viewers when you started talking about Trump. That's all right. If y'all have some issues with her supporting Trump, put them on the comments. You know what I'm saying? Let her address it. But
Right. We can't.
it,
Okay, guys, we can't live in a government. We can't live in. See, a fascist government will have you not like people who have opposing views. We live in America. We're not going to all agree on everything. You may
right.
love Obama. I like Trump. It doesn't mean that we can't sit in the same space and discuss policy and discuss what's important for all of us because we love
Why are
family.
so many people scared of Trump? Why are so many people scared of it? And why do so many African Americans hate Trump?
Fear tactics that were told to them. Because I'm gonna tell you this: Trump has not been a threat to Black people until 2016 when he came down Trump Towers and announced that his bid for the presidency. And then after that, there was a campaign to make sure that Black people hated him. Prior to that, we had no problems with Trump. None.
Um, so there's been a lot of I'm just gonna say this is basically coming from the media. They've been mask shaming Trump
They
and
hate him. They hate him.
because we I haven't seen Trump not one time wear a mask. All right.
Mhm.
And I know Melania tweeted something about wearing mask, and I know one of the
Mhm.
reporters did ask Trump would he wear a mask, and he said he will wear a mask, but I haven't seen him to this day wear a mask, and I watched those press briefings faithfully. So I'm saying all this to say reporters are mask shaming him, and now a few people in the White House have got the
Mhm.
coronavirus. They tested positive, but President Trump here reassured everyone, saying that those people are doing fine. It's nothing
Mhm.
critical or
Mhm.
whatever. But
But were those people wearing masks? I wonder if they were wearing masks. I'm curious.
Who?
The
The
people who became infected in the White House.
He said that they tested negative one day and then the next day they were positive. So, I mean, I guess you really can't explain. I mean, that is very true. That's why I don't feel that testing everybody is efficient
Yeah.
unless it's vulnerable. When I say vulnerable, the urban cities, you know what I'm saying, with a lot of black people, because we see that a lot of black people are dying from this disease. You
Mm-hmm.
know, all of the elderly populations, people with all
Mm-hmm.
the comorbidities, you know, there's huge classes. Like, don't test me. I feel like that's a
Don't
waste. I
test
don't
me.
have
Yes,
any type
don't
of
test me.
medical issue. Right. I
Yeah.
don't have any type of medical issues at all. And from what I know, I haven't been exposed to anybody. If I have, you know, I would be surprised or whatever. But
Mm-hmm.
I
Me
don't want
too.
to waste the test because tests cost a lot of money, right? I
Good
was
point.
watching the briefings today. They're going to be spending like $9 million a month to get these states these antibody tests, you know, so they can people
Mm-hmm.
can see if they've even been exposed to it.
Mm-hmm.
So anyway, do you feel like you know Trump should have been doing something more to protect his staff, or do you feel like it is just the odds, like
Mm-hmm.
they got they got they're positive, they got it somehow, like
Mm-hmm.
you can't be 100% sure, you can't be
Mm-hmm.
100% positive, like even when we all open our businesses, you know what I'm saying? And
Mm-hmm.
that's another thing, like, is the government going to give us some type of exemptions or liability? Do we? Well, I already
Oh,
have
right,
insurance, and
right, right.
I already have insurance, and my insurance actually protects me against COVID. I made sure I'm good, but my business is still closed. But for other businesses, are they going to get some type of insurance? Like what are people going to do to guarantee that you don't get COVID? And can you really guarantee? You know what I'm saying? Can you make people sign waivers? I really don't know all of that information, but yeah. So saying all that, do you think it's Trump's fault, because the media is basically saying, like, how can we trust our president when he can't even keep his own staff safe? How can we trust the president saying that it's safe to open the economy when his own staff, are getting COVID? So what are your thoughts on that?
What about the staff members who are in the hospital because of heart attacks and strokes and other health conditions? It was three people. I think he said it was a couple of
But
people.
it was three people. It was Pence's
Mm-hmm.
somebody with Pence, Trump's driver, and somebody else.
Mm-hmm.
Right. I think Trump's Pence PR person, I think,
Yeah, I think
right?
it's the PR person.
Yeah. And I don't know who the third person was, but yeah, it was three people that test positive. So
So,
is that the president's fault?
no, it's not. It's not the president's fault. And if you look at how many people in this entire country, with 350 million people, we've only lost 49,000. So again, I always put the numbers into perspective, and then look at District of Columbia. So maybe his three people are going to add to the cases, the positive cases. But we don't truly have a lot of people dying. So people can be. We might have a lot of people test positive. Most people
Right.
will recover. We have to see, we got to, the way we're programming ourselves with that other hysteria, we've got to come and
Uh-huh.
say, not too many people are dying. You have a smaller chance of dying when you're not immunocompromised, when you're not extremely young, when you have underlying health conditions, you're 50 and older, you got other issues, you're more likely to really not do well with this. But even a lot, you seeing reports like with 80-year-old women recovering. So it's not just age, so it's a respiratory illness. So tell yourself that not that many people are dying. Being
Right.
positive, testing positive for it, and dying are two different things. So we
I
got to
think people have
understand
in
that.
their mind it's a death sentence. People have in their mind it's a death sentence
Yeah,
somehow.
like an AIDS,
Yeah.
AIDS first came out. Oh,
Right. Anthony says he has a nice golf course in Ireland. Wow, you're from Ireland? Wow, thanks
Ireland.
for checking
Oh,
us
nice.
out. We're in
Yeah,
Detroit and Georgia. Appreciate. Are they the same time zone? Is Ireland the same time zone as United States. I'm not sure. That's the part I get confused. You want to go ahead and read
Okay.
Thomas's
Sure,
comment?
Thomas. I don't care who is president, but it's the legislature that we need to concentrate on since they set the policies. As long as those people support my views, I don't totally commit to Democratic or Republican because people will try to box you in. Absolutely. I'm not part of
I
any
agree with that.
that's a
Yeah.
very good statement. I like that's a very see these are the kind of conversations that are very healthy to have where
Right.
you're not so
Exactly.
absolute.
Yeah.
I never said I was Republican. I say I
Right.
support the president. I didn't even vote for him. So, but I look at everything that he's doing and I look at every American. I'm not just looking at every American he is looking out for based on his policies and executive orders. So I have to respect that. Like I can't take that away from this guy. Take that away.
Right. 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 Um. So we know that people are, restless and they, tired of these stay at home orders. So like, what is the solution from here?
Mhm.
Because I mean, especially for Michigan, because it's a lot of people who cannot stand our governor here. Everybody's saying that those people are Trump supporters, but all of those people aren't Trump supporters. You know what I'm saying? Some of those people, they just, they're Democrats, but they just don't support it for whatever reason. You know what I'm saying? So at this rate, we're going, I mean, you got people going up to the Capitol, you know what I'm saying, like
Oh,
twice a month in these huge organized movements and stuff. We got people suing the governor, you know what I'm saying, just the some of the pastors suing her, some business owners. I mean, you know what I'm saying? Like where do we find a solution? Because I mean, that just seems like a lot of stress in itself. I mean, here you are in the middle of a pandemic. You got your citizens, you know what I'm saying? People in your state, you got all these different groups drafting up law suits against you. And now she even has lawmakers drafting up lawsuits against her. You know what I'm saying? So I'm like, it's just too much. Like, I mean, but I know she feels like, well, I'm not gonna speak for her, so I don't know what she feels like, but I mean, it gives the impression that she's being firm, like she's not gonna bend. It's like bringing on the lawsuits. I don't care, keep protesting, just wear your mask and be 6 feet away. You know what I'm saying? That's
mhm.
basically what she said in the press briefing today. So I mean, like, I don't know what would be your solution in that. You got all these unhappy people, constant lawsuits, people marching on your Capitol grounds. At what point do you just be like,
It's she's a very interesting character, like a lot of other governors. And if you notice the pattern, and that this is the pattern I picked up. If I look at the states that are impacted the most with COVID, these are governors that their constituents should start to question. So it's okay. I feel like this is a really good time because people are starting to see, are you truly creating policies that are in the best interest of your constituents? Or again, are you malaligned with other individuals or other party members who don't necessarily have the state of Michigan constituents' best interest at heart? And this is the time right now. COVID is really exposing because you can see some governors are not, they're not pulling up all these draconian and drastic measures because these are guidelines that the White House stated. And then I would be
you guys didn't have draconian, did you? Did you guys have draconian measures? Because
well,
ours was really strict. Ours was
no,
really strict. You can't do this, you can't do that.
ours has always been just the CDC stay at home if you're sick kind of self quarantine thing. There was nothing ever drastic.
Oh, okay.
Because
Because
there
we
are
had, like, you
arresting
couldn't
people and
garden, you couldn't do this and that. We had all these different
oh
specific
no,
things.
no, no,
Yeah.
yeah. And
Okay.
that's not very safe. And so again, you have to question, well, is this really about our health and safety? And it's a good time to question that as a constituent of a lot of these states because it's teetering. So you have to. So I'm glad that we have COVID, and the president has not made any mandates because he's saying, "I'm giving it to you guys. You're the leaders of
Right.
your states." And now we get to compare. Well, Georgia's doing this, Michigan is doing this. California is they close their beaches and you're arresting people for going to the beach. That's a bit drastic. That's drastic.
Yeah. Yeah. Oh my gosh. Anthony is 145. I'm so humble. We're so humble. You are
Ireland,
joining us
Ireland.
from Ireland.
Yes.
Wow. That
Thank
that
you,
that
Anthony.
is
Thank
amazing.
you. Thank you.
So we follow the CDC, as health professionals. That's what's guiding us. They are considered the experts, them and the World Health Organizations.
Mm-hmm.
True, there's tons of scientists and epidemiologists around the world, but in terms of, what we should be doing, to maneuver through this, we look forward to, Dr. Fauci and, the CDC and the World Health Organization. But CDC, they've been flip-flopping their guidelines. I saw something the other day they post saying, we should be staying at home. And so I'm like, well, this is a contradiction because the president announced this phases plan, you know what I'm saying? And we're seeing some states open. And so now, like, they posted some research, saying that, basically is very, very contagious, and like one person is giving it to three people, and it's just spreading in large groups, and that we are safer at home. So I'm going like, well, when are we ever gonna come out of this? If now we got the CDC saying like we need to be staying at home, like, well, which one is? And then they kind of flip-flopped on, don't wear masks. I was one of the people who went and got my mask.
You're serious.
I'm not trying to brag anything, but just my nursing critical
Mm-hmm.
thinking, and just, I've taken care of SARS COVID. I haven't taken
Mm-hmm.
care of COVID-19, which is the novel virus, but I've took care of the, SARS COVID. When that came out a long time ago, in what, 2008 was it?
Mm-hmm.
Um, so anyway, I was prepared, and plus I had H1N1 as a patient. I got that in the line of duty
Oh,
nursing.
okay.
Yeah, so I'm very familiar with all of this stuff, whatever. Then I've been doing my own research. So anyway, seeing all of that, I got my mask. I was like, I'm not messing around. Got my gloves, and I was prepared and stuff. And this was way long time ago when it first
I
started, when we
remember.
start hearing about it from. Yeah, right. I was posting it.
Mhm.
Everybody was coming. You shouldn't do that, and all of this stuff. It's like, okay, So anyway, nobody told us to wear masks. Now you telling us to wear masks. Then you got nurses telling them to wear bandanas. I mean, they just like flip flop. They've been wrong on a lot of things. World Health Organization been wrong because then it came out. And I mean, to their defense, I don't really want to call them wrong because I mean, people have been researching and studies. We're seeing studies, and it's like, oh, okay, well, we got to do this now because some scientists did a research study and they found this out. So I mean, how do we really know to trust these experts? Can we really be confident trusting these experts when they have been wrong on some things?
Well,
So
again,
what do we believe? That's my question.
COVID is n- COVID is a era. It's created an era of more awareness. And so COVID has a lot of people questioning a lot of things. You have companies now saying, well, with all the unessential people, we can cut operation costs and not have them ever come back. So COVID is bringing a lot of awareness to situations. And one of the big things that I see it's bringing awareness to is the trust and confidence in just having one expert, because now you have other experts who have presented information, and if it's not in alignment with world health, they're being shunned out of the scientific community. So even as healthcare
That's true.
professionals, we are lobbyists. We our patients' safety is priority. And so we have to trust and have confidence in these experts. And if we can't trust and have confidence in them, maybe this is a policy issue, a lobby issue that we need to take up as healthcare professionals, because I have to
Yep.
teach people, and people count on me for my authority as a healthcare worker. And if you got people flip flopping on information, they're not going to have confidence in me, because now I'm
Right.
quoting inconsistent people. And so
Right.
that's a problem for me as a professional and as nurses and healthcare professionals. It's time for us to start lobbying and being more politically aware. And we need to be a lot more active for our patients.
Absolutely. Dr. Lino, she says she finds it hard to believe
It's all
that
about
it's all about. I I agree. Yep.
Yep.
You're right.
Yep.
A lot of this was embedded in politics.
It is.
Yeah. Yep. I mean, it's obvious. I mean, you would have to be living under a rock to not think that some of this stuff wasn't
And who are
motivated,
the casualties? Patients. Who are the
Right.
casualties in this political war? Unfortunately, the families, people like the barbers and hairdressers, people not getting unemployment because people are not truly looking out for the best interest of the American health and safety in its true and pure sense. It's games being played right now.
Right. Angela says, she doesn't. Why don't you like Dr. Fauci? I know it's been a lot of it's been a lot to be said about
Does the
him.
Fitbit tell the truth like heart rate?
Oh, yeah.
Mm-hmm.
Yeah.
Yes, it does.
Yep. So share your thoughts on what people should be doing to stay healthy
Mm-hmm.
throughout this pandemic, because our immune systems are one of the most
Mm-hmm.
important
Mm-hmm.
systems in our body, I think. And so, you know, what can people do to keep their immune system healthy
Great question.
so
And
they can fight off this?
you brought up one. First of all, we need to understand that our health is not only what we eat and ingest, it's also what we think and believe. So you can become
That's true,
very unhealthy thinking in a very unhealthy way. And to
because we had chemicals in our brain. Yep.
Yes. So when you are starting to ingest unhealthy ways of thinking and seeing the world as to you have to be hysterical and the whole world is you're okay with a continuous shutdown despite the data that shows that it's not as severe, then you have to question the health of your mental, because now we're talking about fear, which again is linked to immune system. If you live in fear and hysteria, you're going to lower your immune system, which is not healthy. And like she said earlier, Nurse Charm said earlier, the main people talking about stay at home, y'all obese, you ain't got no
Right.
glucometer, you ain't got no updated test strips, you
Right.
smoking, you haven't picked up your refills for your lisinopril, yet you ain't did nothing you was supposed to do to be healthy. But you got everybody else supposed to be scared. You have to take care of your mental health and your physical health and feed your
Yeah.
immune system so that if you walk out and test positive, it ain't a death sentence. This disease is not a death sentence unless you got asthma, diabetes, cancer, underlying
Right.
respiratory, mainly respiratory cardiac issues, clotting issues. So if you had a stroke, you got diabetes, all of those things, you need to be taking care of your health anyway.
Right. Absolutely. Let's see. We got some more comments here. Angela, oh, she's just following up. She says Dr. Fauci has a checkered
Pass.
past. There's a documentary. Yeah, they do keep doing that. That documentary. Go ahead and read what Thomas said, please.
Thomas says expert advise leaders make the decisions to provide the overall morale of the people and see the bigger picture. If we only do what the scientists say without taking in other factors, then it will be more harmful psychologically. Thank you, Thomas. Thank you. Well said.
Yeah,
Well said.
yeah. That
Hmm.
was a good comment.
Oh, night
Let's
night,
see,
Anthony.
Anthony. We appreciate you. All right, sweet dreams.
Yes.
Uh,
Dr. Lino.
Dr. Lena throwing up her hands.
Yes.
we said a word for her.
Okay.
Yeah, yeah, listen, everyone joining us tonight, we appreciate your engagement. You guys asked some good questions, made some great comments. We appreciate all of you. Let's see, Angela, she says good night as
Angela.
rest well.
Right.
Yeah. So listen, tell everybody how they can get in touch with you. Do you offer any services if anybody wants to reach out to you? Go ahead, do your promo.
Sure. You can reach me through Level Up Goddess on Instagram. I have a link tree account, T Young or Level Up Goddess. Follow me on Instagram, Level Up Goddess. If you have any questions about, getting out of bedside, going into non-clinical, non-traditional nursing roles, feel free to reach out to me on Instagram and DM me for sure.
All right. Well, we always go over time on these things, but the people who watch and support, they really keep this going. So,
Thank you.
continue to spread the word. Everybody continue to check me out. I'm always here evenings, weekdays, 8 p.m., 8 p.m. to 9 p.m. And we just do our thing. We talk about all the trending topics going on. We talk about all the, breaking health issues, and we always welcome feedback, your questions. So we enjoy all of our viewers. And listen, Nurse Tasha, you have been an amazing wealth of information and knowledge. Yep, kisses back to your girlfriend. Thank you so much for joining me, and you take care.
Thank you so much,
And
Charm.
I'll be
Thank
in
you.
touch with you. You're
Thank
welcome.
you.
All
Thank
right.
you. Bye bye.
Good night, everybody. All right.